We want to tell you about a potentially deadly form of cancer without any kind of symptoms. Prostate cancer is the second leading cause of death for men, but there are some preventative measures that you can take.
Joining us now to explain more is the chief of robotics and minimally invasive surgery at the Mount Sinai Medical Center, Dr. David Samadi, frequent guest on Good Day New York, and cancer survivor Patrick Walsh, who just had surgery in February. Sir, how are you feeling?
Very good. Very good. Excellent.
Yeah?
So what happened? Did you have any signs at all?
No, I'd been monitoring my PSA for about 10 years. I had no symptoms at all, and my PSA elevated, and I decided that I should probably have it taken care of.
Now, Dr. Samadi, when he first came to you, you didn't think, or he was under the impression that it was not a large mass.
You know, the issue that we have with prostate cancer is that they come in and they have a small amount of cancer. And since there are no symptoms, it's really hard to tell them you need to remove this. But the truth is that in 40% of the time, Rosanna, what you see before and what you see after the surgery are completely different. So years ago, we were doing these seed implants, radiations. A lot of people are now going or thinking about HIFUs, but the only option that actually removes the prostate tells Patrick how much cancer you have, what type of cancer you have, and today, 9 months after, the fact that his PSA is 0, and we can celebrate his health. Sure. He has actually, I found out in the green room that he has a wedding, his daughter is getting married. So the fact that he's walking to his daughter's wedding cancer-free with 0 PSA. So we have a marker that will tell him that he's cancer-free. That's a big deal.
You did the operation?
I performed the surgery robotically. As you know, Greg, you're the master of that because we've had a lot of discussion about this.
I just like robots. It's so cool. So you did not have to really, non-invasive. I mean, you were in and out of the hospital how long?
I was in and out of the hospital in a day.
In a day?
I was operated on at 2 o'clock. And I was home the next day by 2 o'clock.
What are the risks of doing something like this?
I think like anything else, the technology is the technology, but it's the experience of the surgeon, it's the program, it's the team. Like any other option, if you really know what you're doing, then you can get these patients in. This was an hour-and-a-half operation. He stayed overnight on a nice floor. He was home the next day. So, you know, you have the routine. You have the team. Everyone is concentrating on this. And for someone like him, if we would have opened his abdomen, he would have been really had a long recovery. He would have stayed out of duty for a long time. Sure. So I know it's sometimes, Rosanna, it sounds to be too good to be true.
Right.
But this is like 1 out of thousands of patients that go through this and do well. And
couple of quick things. The PSA, you mentioned that your PSA wasn't showing up before the procedure. You found cancer anyway. And now you're still talking about, well, 0 PSA. PSA may or may not be an indicator, a sound indicator about cancer.
Well, we know that for prostate cancer, as long as your PSA is 0, I can look at them and say you're cured from this. But I'm glad you brought this up, because if the cancer ever comes back, and in about 5 to 10% of the patients, you may have a recurrence, you can always save radiation for only after surgery as a safety measure. As long as he's cured, let him enjoy his life, let him take care of his children and family. But if the cancer comes back, Greg, you can give radiation after surgery, but to do surgery after radiation would be very difficult.
Your advice to men right now who maybe are not taking care of their health properly?
What I would say is, instead of talking to men, I'm going to talk to all the ladies out there. And if you have time, you want to work with us, you can always email us, because women are the ones that bring the men into the office and say, get tested. Don't be scared. There's nothing to panic. Since you don't have symptoms, you don't know if there's something wrong. Get tested, get your PSA, but look at the trend of that test, not the absolute value. Look at what it was 2 years ago, look at what it is now, and then find yourself someone who's dedicated to prostate cancer.
Anything else? Real quick, eat something, don't eat something. What else? To preventative steps we can take. Something simple.
I think for guys like us, take lycopene, pomegranate juice, exercise, and eat healthy. But lycopene is really the best vitamin out there for prostate.
Excellent.
And that's really...
All right, Dr. Samadi, thank you so much for being here. And also, thank you,
Patrick Walsh. Great to meet you. And
the Patrick Walsh.
The Patrick Walsh.
Good man.